Hi everyone, this is our weekly blog, and I have with us a guest. This is Jason Smith. He practices in Madrid, and he's been practicing there for many years. He has his own Chinese medical college in Spain, and we had the pleasure of working with him for our first Spanish course, which was a couple months ago in Madrid. So Jason came to visit us in our clinic and has been watching us for a few days. And so he's written down some questions that he wanted to ask that he thought would help all of us, including his Spanish students.
Yes, Bob. I have a big question regarding DNA. I've seen you almost always use image and half image, but occasionally you do quarter image, and specifically sometimes I see you needle the abdomen, and other times you do the scalp. So I wanted to know exactly what do you look, which points you use on the scalp, and when do you use the abdomen, and what for do you use the abdomen?
As we all know, that acupuncture, as with anything, there's some degree of an art form to it. So if I enter a room, and so I always ask the patient where are the pains, and depending on how they speak to me and how their voice, I'll kind of get an idea of what image would work the best. And sometimes I'm wrong, and I just have to use other images. Most of the time I'll go to a full image, so I'll needle from the elbow to the wrist and from the knee to the ankle. But sometimes what I'll do is I'll try a shortcut. Now I'll take the pain wherever the pain might be. Let's say it's in the shoulder. And then I'll just draw a line from the pain straight down till it hits the wrist, and when it hits the wrist I'll stick needles in that area. Very often that will take away 50% of the pain, just doing that. Then I will use another image and vessel relationships from Dr. Tan's 6 systems of vessel relationships, which we learn in DNA. I will do that. And if I see, once the needles are inserted a little bit, I'll get an idea of how the patient responds. And sometimes they don't respond very well. Sometimes they'll say, well, it's a little bit better. So then I start getting creative. And when I get creative, I'll go to these quarter images, and I'll go to scalp acupuncture, and I'll definitely use the abdomen. I use the abdomen mostly to treat lower back pain. And all I'll do is I will decorate the abdominal area directly above where they feel pain. And I use a lot of needles. I'll use 10, 12 needles on the abdomen. I'll just sort of decorate the whole area above the pain. If when I'm putting the needles in, the patient doesn't respond much because they have a lot of adipose tissue, then I'll take 2 needles at once and I'll stick them in. So I'm using a 32 gauge needle, but when you use 2 together, it's a 16 gauge needle. So now I'm sticking 16 gauge needles, and they're going, oh yeah, oh, I feel that. How's the pain in your back? Well, I don't know. Good, arch your back. I'll have them arch the back. How do you feel? Generally, they won't feel any pain at all. And I probably already drew a line, sort of imaginary line, from the pain in their back down the back of their leg, and when it hit the ankle, I've needled that already, either into kidney 6 or UB60, into those joints.